This case study presentation is presented by myself, Sarah Muir, dental hygiene student in the class of Dental Hygiene Case Development. For this case study, I have used the ADPIED. ADPIED stands for Assess, Diagnose, Plan, Implement, Evaluate, and Document. When we assess the patient, we are collecting objective data that includes the patient's health history, clinical assessment, and risk assessment. We then diagnose by interpreting the data and use our critical thinking skills to identify health conditions and behaviors that can be addressed by the RDH and oral health team. Then we plan by selecting strategies and interventions that meet the needs of the patient. Implement is next, which is starting the dental hygiene care plan. We will then evaluate by determining if the patient must be retreated, referred, or appointed for continuing care. The end of the process is done by documenting all aspects of the patient's care. We will first go over the assessment process. The patient we will be reviewing is Mr. James Henry. This patient is a 74-year-old male that is a retired golf instructor. He came to the dentist because he says that he has bad teeth and wants to keep them as long as possible. We can see in his medical history that he currently has high blood pressure and diabetes. He previously smoked for about 45 years, but has quit smoking and hasn't smoked in the past 12 years. He was hospitalized in 2002 for a torn rotator cuff. He is on a controlled diet due to his diabetes and takes the medications bisoprolol and lisinopril for his high blood pressure. This is a copy of his medical history form. During his dental assessment, we learned that he has not been to the dentist in about 7 to 10 years. He does brush about 1 to 2 times a day, but does not floss due to it being difficult to do with his arthritis. He is not experiencing any dental pain. His oral assessment shows that he has moderate to heavy generalized calculus with some gingival calculus also present. He has generalized inflamed gingiva with red margins. He is at periodontal stage 3, grade B. Using the ODRA, we will discuss the etiology of the periodontal disease. We will also go over modifiers for flossing and the importance of maintaining periodontal disease with regular dental cleanings and exams. I will also inform the patient that his medications could also affect his oral health by causing xerostomia. In these intraoral photos, you can see the visible generalized calculus as well as the inflamed gingiva. His dental charting shows existing fillings, extractions, root canals, and crowns. He currently has no active decay present. His periodontal probing shows generalized bleeding on probing with generalized 4 mm pockets with localized 5 to 7 mm pockets on the molars. He has localized recession on tooth numbers 14, 15, 24, 25, and 29. Here are his x-rays where we can see existing restorations as well as moderate bone loss on upper and lower molars with radiographic calculus present. His oral risk assessment shows that he has pathology risk factors of being over 60 years old and having diabetes and high blood pressure. His caries risk factors are his existing fillings, root canals, crowns, and extractions, as well as infrequent dental exams. His periodontal disease risk factors are the presence of subgingival calculus, generalized inflammation, radiographic bone loss, 4 to 7 millimeter pockets with bleeding on probing, and attachment loss. Through motivational interviewing, I will talk to the patient about his daily oral hygiene routine and which products he is using at home. I will then educate the patient on the causes and symptoms of periodontal disease and dental caries. I will show the patient his x-rays and intraoral photos that show the calculus he has as well as the bone loss that is visible on the x-rays. I will also explain how his diabetes is a risk factor for periodontal disease. I will discuss with the patient the importance of oral health to our overall health and encourage him that periodontal disease can be managed with routine dental care and adequate home care. Next, we will go over the diagnosis portion. His caries identification shows no active decay. When diagnosing the radiographs, we see he has previously had number 1, 6, 16, 17, and 32 extracted. He has root canals on number 19 and 31 with crowns on 19, 30, and 31. You are also able to see generalized horizontal bone loss with vertical bone loss present on number 3, 15, 30, and 31. The diagnosis of his periodontal disease is stage 3 periodontitis that is grade B. The rationale behind the diagnosis is an interdental CAL of 4 to 9 millimeters present with probing depths of 4 to 7 millimeters with bleeding on probing and generalized horizontal bone loss that is greater than 50%. In the next stage, we will go over the planning section of the case study. The treatment plan will consist of 4 appointments. The first appointment is the initial appointment for the patient. At this appointment, I will go over the patient's medical and dental history. I will take the patient's vitals, as well as a full mouth series of x-rays, a panoramic x-ray, a full mouth series of intraoral photos. I will chart existing restorations to the patient's dental chart, periodontal chart, perform an oral disease risk assessment, and then the patient will see the dentist. He will then have a comprehensive dental exam. The dentist will discuss findings and create a treatment plan. When the patient returns for his second appointment, we will start with reviewing his medical history for any changes and take his vitals. We will be starting on the right side of his SRP at this appointment, but before getting started, the dentist will come and administer local anesthetic. I will then perform the right side SRP with Cavitron, hand scaling, exploration, and flossing. When the cleaning is complete, I will demonstrate brushing techniques and encourage the patient to invest in an electric toothbrush and demonstrate flossing. Chlorhexidine rinse will be sent home with the patient for him to use 1 time daily for 1 week. I will also give the patient post-op instructions that consist of telling the patient that his gums may be sore as the numbing wears off, and that he can take Tylenol or ibuprofen for pain and can also rinse with warm salt water. At his third appointment, we will start the appointment the same as the second, with reviewing medical changes and taking vitals. The dentist will come and administer local anesthetic to the left side at this appointment. I will then perform the SRP of upper and left side quadrants with the Cavitron, hand scaling, exploration, and flossing. I will reiterate brushing and flossing techniques and go over post-op instructions again. I will schedule the patient to return in 4 to 6 weeks for his post-SRP evaluation. The patient's fourth appointment will be his SRP evaluation appointment. When he returns for this appointment, we will start with reviewing medical history and taking vitals. I will do a full mouth periodontal charting to document gingival improvements. I will complete the appointment with coronal polishing and flossing. I will discuss with the patient the improvements in the amount of plaque present and show the patient where he still may have improvements to make. When educating the patient, I will discuss the importance of routine dental visits to monitor his periodontal disease and halt progression. I will talk to him about the correlation of periodontal disease and diabetes, as well as how smoking in the past could have been a factor as well. I'll review pocket depths with the patient at the reevaluation appointment and show improvements from the SRP, and show the patient comparison intraoral photos from his initial visit to his evaluation appointment after his SRP. Although the patient does not have any active decay, I will discuss with the patient what causes caries and how his blood pressure medications could cause dry mouth, which puts him at a high risk of developing caries. My anticipated outcomes for this patient are to have decreased pocket depths, decreased bleeding on probing, no bleeding when the patient is brushing or flossing, stabilized periodontal disease, and an increased frequency of brushing and flossing. Next, we will go over the implementation. The implementation for the patient will be that local anesthesia was given at visits 2 and 3 for right and left side SRPs. The patient tolerated anesthesia well with no adverse reactions. The patient was advised to perform a warm saltwater rinse at home if his gums felt sore, and that Tylenol or ibuprofen could be used to alleviate gum soreness. The next step is the evaluation. For the patient evaluation, the patient currently is on a 3-month periodontal maintenance recall. The patient will remain on a 3-month recall for at least 1 year, and the patient will then be re-evaluated to see if a 4-month recall is appropriate. The patient's plaque and calculus levels were greatly improved after his SRP was completed, and the patient mentioned that he did purchase an electric toothbrush. Last is the documentation portion. Throughout the course of implementing the treatment plan, I was able to meet the patient's needs following the ADPIED guidelines. My assessment showed the need for dental care for the patient's periodontitis, which I was able to complete. I believe with regular dental appointments and with patient's continued compliance, this patient's periodontal disease will be controllable. My patient was satisfied with the improvement of his oral health as well as the dentist. We were able to meet the unmet human needs of our patient by educating the patient on oral health with his diabetes and high blood pressure, and through the process of his SRP and periodontal maintenance visits. During this experience, I would consider my approach to informing the patient of his periodontal disease through description and documentation was my strength, and I would consider a slight weakness would be determining his unmet needs. I think my patient has benefited greatly from this course of action, and that I will continue to see success with this patient.